everybody, welcome back. Dr. T, I'm here with Dr. Stacy Thomas.
Another Dr. T.
Yes, T&T. I'm all dressed up for you, so there you go.
Thank you, I appreciate it.
It is Brain Month, and I see a lot of patients who are suffering with a lot of anxiety and depression, especially when they are suffering with low back pain or any other conditions, right?
Yeah.
So, and I figured that, you know what, they could use your expertise in terms of what are some strategies that people can utilize.
Well, I think the first step in a lot of ways is awareness. I mean, when we're in that kind of state, we just take our reactions for granted. Mm-hmm. We have pain. Of course I'm going to be upset. Okay? But we don't take the time to really think about the step in between. And reality is we perceive everything through this thing between our ears.
Right.
And that's colored by our experiences and our state. So when we're in pain, it makes sense that we'd be more irritable. And that will kind of color what we notice, color our tolerance, color our behavior. So they're all linked. So the type of therapy that I tend to do with people as a psychologist is called cognitive behavioral therapy. And what that signifies is the understanding that our thoughts, our behaviors, our moods, and our physical state are all connected. Mm-hmm. And so changes in one of those spheres can create changes in others.
Right.
Okay? So in my area, I'm mostly focused on the thoughts and the behaviors.
Right.
Okay? And so one of the things that I'm always aware of, particularly with people in pain, is, but it could also be if someone is super anxious, is lowering that arousal level.
Right.
Okay? Because when we're in that state, our nervous system gets stuck in a situation where it thinks it's an emergency.
I would actually say it actually winds up. It actually,
exactly.
Yeah.
So what we want to do, that is not a state to be in over a prolonged period of time. Okay, that's, people may have heard about this fight or flight response, or
right.
Sometimes when it's extreme, it's freeze. We're just paralyzed, literally. And so we want to lower that to bring things back to normal, which is where that part of our nervous system is dormant. And the other part of our nervous system that takes care of the things we don't normally consciously think about, our immune system, our ability to think creatively, solve problems, our ability to sleep, digest food, all of that. If the fight-flight system is elevated, the other one doesn't work so well. When the fight-flight system is elevated as well, I mentioned before that it affects our ability to think. Okay? So we are in a state where we're sensitized to notice signs of threat.
Right.
And we tend to kind of fixate on it, and it's hard for us to come up with solutions. It's kind of like we're fixated on the threat coming towards us, and we start ruminating about the problem, but the solutions are hard to come by. So the first thing that I tend to do is teach people how to breathe in such a way that tells the nervous system there's no emergency here. Okay? Once you do that, you can start to become aware of the kinds of thoughts that go along with the pain, with the anxiety, with the low mood.
Right.
And there's been a lot of research on people in those states and what their thinking is like. And what they find is that people who are under prolonged stress, when they're depressed, even at little moments through the day when we feel stress, there's kinds of thinking that go along with that. So once we're aware, we can do something to change it. And this kind of thinking has two names that have become well known. The very fancy technical name are cognitive distortions.
Okay.
Okay. And essentially, that's recognizing that these are thoughts that are distortions of reality, and they're skewed in a particular way. They're very negative. And it's not that the reason they're called distortions is because there are other things that are going on in the situation that the person can't see, that they're not taking in as part of their evaluation of what's happening. Okay, so the other name that people might be more familiar with are automatic negative thoughts.
I love that. ANTS.
Yes, yeah, that's a cool acronym.
This is actually called Dancing with Ants.
Okay.
Yes.
Well, yeah, and what I like about that term is it's very simple, and it recognizes how quick these thoughts happen. We don't even recognize that they're there. It's just when we slow the process down that we can start to see that, you know, maybe I was fixated on that one negative thing that happened, and people are trying to tell me that, you know, but didn't you notice that this went really well, and people were really interested in that, and there's a lot of positives, and then I just minimize that, and I just fixate on this one thing that didn't go so well. Right? Sometimes a person might be jumping to conclusions when they don't have a lot of information. They just assume the worst.
For sure.
Right? Read people's minds, read into people's behavior, always in a negative way. One that's really common among people with pain is trying to discern the feelings from the facts. Okay, so they feel awful, so something really bad must be going on. And, you know, both of us have worked with people with chronic pain.
Absolutely.
And that's a really confusing situation where the pain is no longer an accurate signal of damage, right? But if we're behaving and responding as if it is, you can imagine the level of anxiety people must be feeling from day to day, right?
And I think this is it's amazing. Like, you know, sometimes we use a different language, but we're talking about the same concepts.
Yeah.
So when you have pain, your nervous system tilts into a sympathetic dominance in terms of what you were talking about. Yeah. And a lot of times there's this added anxiety. Oh my God, am I going to be this? Am I going to be like this for the rest of my life? You know, so there's like all these added projections that people start making as well. And again, I do it myself. I don't think any of us are immune to it, right?
No, absolutely not.
So the question is, like, I think to some extent, being able to recognize those and not to be owned by those and not to be moved by those.
Right.
Right?
And so part of what we encourage is this, something that's become far more common in our culture is this idea of mindfulness. Being able to step back from your thoughts and evaluate them.
Right.
So it's not about kind of just telling yourself everything's going to be okay. That never sticks. You know, when you're distressed and someone's like, you know what, it's all going to work out. It's all for the best. You're just like, it doesn't work, right? There's no meat to it. There's no evidence. There's no data. You've got tons of data about what's going wrong.
Right.
And just telling me it's going to be all right, it doesn't fit right now. And so what we teach people to do is to look at it objectively. Okay, what are the thoughts that you're having that are leading to these feelings of distress? And part of the work is trying to get those out, trying to identify them. Usually by writing them down, we're able to slow down the thinking process a little bit. Okay, just slow down the reaction, and then stand back and look at it. And when we identify that thought that's really driving the emotion, it's about saying, okay, what is the evidence that supports this thought? What is this based on? What do I know about my situation that really led to this way of thinking? Okay. And then the more important step is asking the question, what do I know that doesn't fit with this thought that's causing the distress? What are the exceptions? You know, so when we are in that distress mode, again, things tend to be skewed more negatively. We tend to overgeneralize. We say things like never, always. Maybe we have even some standards that are impossible to meet given the change in our circumstances that cause distress. So there are different kinds of negative thoughts, but the main message is being able to stop, look at them, and evaluate them. And usually when we go through that process and we look at the evidence for, the evidence against, the next step is coming up with a balance. Because it's not all roses, right? There is truth to both sides. And usually when we really stand back and take a look, we come up with a balanced alternative thought that recognizes the challenge, but also some of the resilience or some of the evidence that suggests that there is some hope, that things can change. And when we do that, and we ask about how you're feeling once you go through that process, the level of distress comes down. And so this is the kind of thing most of us are pretty good at when we do it fairly organically, when we're feeling relatively well. When we've been in a state of chronic stress, whether it be due to pain or other life events, it wears us down, and we're not as good at doing that. And so having some structure and teaching the brain to do that again.
Right.
At first, it feels awkward. At first, it takes effort. But like learning anything else, it becomes more automatic to the point where you don't have to sit down. Like you notice you have a reaction, you have that thought, and you're able to catch yourself early and kind of be talk that other side to yourself and recover more quickly. So we're not staying in that high level of distress and recovering and moving forward. And usually it allows us to take some action, right? To make an active choice. So that's the difference between being reactive and being able to respond to a situation, right? With awareness, making a choice as opposed to just feeling like you're being led by circumstances.
So I love that. And I think to me, what is really amazing is there's a nuanced way of looking at it. Mm-hmm. That you have to be able to analyze the data correctly, and also question it, and then be able to take a step back and also realize this is very hard. It's like any skills.
Right.
You have to be able to build into it. And to some extent, be good to yourself. You know what? I don't think anybody has mastered it, but it's the pursuit of this is what's going to give us the benefits. And again, when there's a multiple threat to the system, mm-hmm. it becomes more difficult. So that's why I love the idea of being proactive. When you're in a great space, when you're in a great moment in your life, try to actually enhance those skill sets.
Yes.
So when you are in a state of panic or trauma, you'll be able to again to go back and then be able to utilize those.
I'm glad that you mentioned that, because one of the things that we found is key to relapse prevention. So people who have had a hard time, maybe have got to the point of feeling depressed and they recover, is mindfulness meditation.
Yes.
That is one of the best ways of maintaining what they've gained. Mm-hmm. Part of that is obviously the awareness piece, right?
Yes.
When you are dedicated to integrating mindfulness in your life, you have that ability to stand back from your thoughts and evaluate them, and not necessarily just react, but choose a response. There's also a calming aspect of that practice that helps keep that nervous system fine-tuned, and that parasympathetic system,
for sure.
the one that should be elevated most of the time, where it's supposed to be. And so, it sounds like a trend. I'm hoping it's a growing trend.
Yes.
Because it's what our culture needs, absolutely. And it works. We have the data. I remember when I was in grad school about 20 years ago, at that time, CAMH was really studying mindfulness at that time. And now we have the data after many years that it is a proven method, and something that needs to be a foundational skill as far as I'm concerned for everyone in our culture.
Absolutely. So hopefully, you know what? Thank you. You actually gave us some wonderful information and insights. And anything else you want to add?
No, just that, I really appreciate being invited to speak with you and to share a bit of what I know. Because this is what it's all about. Both you and I are about prevention.
Absolutely.
And giving people tools that they can use themselves.
Right.
And the thing that's also very important for people to understand is the things that you think, the behaviors that you engage in, your environment. We know now that it actually has a tangible impact on the structure and the functioning of your brain.
Absolutely.
This is more powerful than any medication that they could ever come up with. Okay? It's a very hopeful discovery in terms of not only validating the kind of work that we're doing with people, but it will lead to new technologies, new approaches. Okay? And one of the things I tell my patients all the time is that every time you win over anxiety or depression, you're literally putting down the foundation for a new pathway in the brain.
Yes.
So each time that pathway begets competition for stress. Those other pathways that maybe have gotten too much traffic, right? So you're creating that competition. And so it's even important to have that image in your mind of actually creating those pathways. And it can lead to real lasting change. The key is maintaining it, right?
Yes.
And maintaining that lifestyle that will be conducive to that. We're all going to slip, but if there is one thing I would say as a takeaway is if you don't know what mindful meditation is, find out and see about ways in which you can integrate that into your life.
Perfect.
Okay. Great.
Thank you.
You're welcome.
Thank you, guys.